to get rid of hot flashes. Yes, hot flash. You know, that symptom that every woman, well, maybe almost every woman in menopause experiences. So, hi, I'm Dr. Olusegun. I am the internal medicine doctor here at Angelic, and I help women, men also, to balance their hormones, to lose weight, to deal with autoimmune diseases, and help their skin look healthy, younger, and smoother. Okay, so today we're going to be talking about how to get rid of hot flash really quick. Okay, so first, what is a hot flash, right? So we have to really describe this because a lot of patients mix it up with night sweats, and I want to make sure you know the difference. Those of you that watch this channel, you must know the difference. Why? Because the treatments are different, okay? If you mix up your night sweats and your hot flash, the doctor is going to be giving you the wrong treatment, okay? So a hot flash is the symptom where the heat comes from the belly and just rises to your head. Okay, what does that mean? It starts from the belly, like below your belly button, somewhere deep down there, and then it slowly rises to your head. But only happens during the day, okay? If you are getting symptoms like that at night, that is night sweat. We are not talking about night sweats. During the day, you get this heat that comes, just all of a sudden you break into a sweat, all of a sudden you're super hot, everybody else feels fine, and then you gotta fan yourself down. Try to stick your head in the fridge. Try to go into the refrigerator or the cooler or something to try to get this heat down. That's what we're talking about, a hot flash. Okay, these are considered vasomotor symptoms. When a woman is starting to get into that menopause age, we see this a lot. Why do we see it? What is it? Well, it's a way for your body to signal that it is basically losing its hormones. It's losing too much estrogen and it's not able to keep up with demand. And that is one way the body lets you know that, hey, I need help here. I've tried to get my estrogen from other sources and I just don't have enough to really supplement what I need done. So then the body gives you that signal. The minute you see it, you're supposed to go to your doctor. The doctor's supposed to check your estrogen level and then make some recommendation. So here's the recommendation most women get. Antidepressants. Okay, let's talk about that. Is antidepressant what your body is asking for? Your body is saying, my estrogen level is low. Why does your doctor hand you an antidepressant? Well, because an antidepressant sometimes treats these vasomotor symptoms. It makes those go away. But it's just a band-aid. It is not addressing what the body wants. So then you're still going to experience all of the downside of not having estrogen, like vaginal dryness, like memory loss, like irritable mood. All those are still going to be there because we have not addressed the underlying issue. So when you have the hot flash and the doctor hands you an antidepressant and you've watched this video, you're going to go, no, that's not what my body's asking for, okay? So what do we do instead? Well, one of the biggest issues we had and why doctors hand out antidepressant instead of giving you estrogen was because of a study that was released in the early 2000s called the Women's Health Initiative. And you can read about the controversy about this, this study. In fact, I'm going to do a whole video on that one. But just to summarize it, this study kind of scared doctors about giving estrogens or progesterone or any hormone for that matter. Okay, so basically, when this study was done, the way it was designed, there were some flaws in it. The medications that were used, there were some flaws in it. And it came back saying that women were more at risk for using hormones than not, right? So a lot of doctors shied away from using hormones and they started prescribing antidepressants instead. Well, the antidepressant is not fixing the problem. What we really need to look at is, instead of giving women synthetic hormones, synthetic progesterone, or hormones from pregnant horses, which we call Premarin, or the synthetic progesterone called Provera, what we really need to give women is bioidentical hormones. hormones that are exactly similar to the ones that your own ovaries used to make. And that's what I use in my practice. My patients are doing better, their symptoms are gone, their body's happy that I give it what it's asking for and not just band-aid it with antidepressant. So what else can you do besides taking bioidentical hormone? Because some women are like, nah, I don't want to use any hormones. Okay, well, here's a couple other things you can do. You can start exercising, that helps hot flashes. You can stop drinking alcohol. In fact, some women have noticed that alcohol triggers a hot flash. Yes, try it, pay attention, okay? If you drink alcohol and all of a sudden you're feeling hot, well, you just triggered your own hot flash. Second, you can start drinking lots of caffeine, coffee, and spicy foods. Well, there goes all the fun, okay? Now, you can also use a supplement called black cohosh. Okay, so a lot of women have successfully used this natural supplement called black cohosh to diminish their symptoms. Again, kind of like the antidepressant, it's only masking the symptom, it's not giving you the underlying thing your body is asking for. Vitamin E. Yes, vitamin E is an egg. You can use that to also diminish the symptom of hot flash. Yes, it's diminishing the symptom, it's not fixing the underlying issue. And finally, evening primrose oil. This has also been helpful for some women to help them diminish some of the symptoms. Those are supplements you could try if you don't want to use any hormones, but I'm telling you, what your body's crying out for when you get a hot flash is, please, I need some hormones. Give it some hormones, okay? Just give it a good one, the natural kind. All right, I'll see you on the next one. Bye.